Hey guys, welcome back to Medical Coding with Blue. First, I want to thank all the people who have viewed one of my videos. It is as a day in the life of a medical coder. It just hit 1,000 views last night. I am so excited, so thank you so much. And it gives me more encouragement to do these videos every day. And I hope that you all continue to enjoy these, and I hope that they give you some sort of something that you can take away from it. I would have liked to have seen these videos when I was becoming a medical coder, because it's nice to be able to hear from people in the field what's actually happening and what's going on, you know? So today, I kind of want to talk about what it's like being a medical coding student, or if you're considering getting into the medical coding field. I have a couple of videos on how I got into medical coding and is medical coding right for you. So just be sure to look through my videos and you'll be able to find out. But very briefly, I got into this field on accident. I mean, literally, like, medical coding found me. I didn't go out and seek it because I knew nothing about the medical field. I have no previous background experience in medical at all. So when I was unemployed and I had gone to my workforce office and they had offered this program for medical coding, actually they had like a bunch of different things, but medical coding was one of them. And so I wanted to take accounting because I was all about numbers. I mean, I'm a math whiz. I mean, I can do math in my sleep. But they were like, well, what about medical coding? And I'm like, well, I kind of really wanted to do accounting. And then he goes, no. You really want to look at medical coding. Just feel it out and see. He goes, and if you go and you don't like it, if you look at the schools and you say it's not for you, then let me know and we'll get you into accounting. But as I got to researching it, I was like, this sounds like a pretty good field. I think I can do this. So that's how I ended up getting into it. And I had gone to the school, and I went to a self-paced school. So basically, it was a 9-month program, and I made it through in 6 months because I'm just a driven person, and I love to read. So that's just me. And every time we passed a section, or I passed a section of this program, I got a new set of books. So that was always like, if you put books in front of me, I'm like, we'll work for books, I am a book freak, and that's that was what motivated me too. And then plus, as I was learning medical coding, I was like, oh, this is really interesting. I really like to read into this. So some tips that I can give is that if you are doing a self-paced program, if you're doing an accelerated program, make sure that you take the time to study additionally on your own. And this is just to set yourself up for success. You don't want to go in and think that, that it's going to be easy, because it's not. I mean, it is learnable. It is teachable. I have said this already. It is learnable and teachable, medical coding. But if you're not applying yourself, it's going to get difficult, because medical terminology and anatomy and physiology are your 3 best friends when you're in school. If you can master those, at least you'll have a basic understanding. And of course, you have to understand the rules of coding, but you got to get those 3 down first. Because if you can get those 3 down, at least you can have an idea of what's going on. Because in medical coding, there are diagnosis, and then there's a definitive diagnosis, right? There's symptoms and there's definitive diagnosis. So it depends on where you're coding, what setting you're coding in, whether you're coding an outpatient or an inpatient. You have to make sure that you're paying attention to how these diagnoses are presented in there. And obviously, if there's a symptom of a definitive diagnosis, then you don't want to be picking up symptoms. And how do you know if something is a symptom of something else, or a symptom of definitive diagnosis? Look it up. There's a lot of situations where you're going to be looking up stuff. And even still to this day, I am learning things. Like just today, I learned about a bony bank heart. If you don't know what it is, look it up. Because I thought, it's a tear. No, not a tear. Bony bank card is something completely different. So, I mean, it's just one of those little detail things. And this business is all about the details. Okay? So, and it's not enough that you get through your schooling, and it's not enough that you get your certificate. You still have to pass your certification exam, which is something completely different from a certificate, because sometimes people will go through a program and they'll get a certificate that says that they completed like medical billing and coding, but they still have to get a certification. You still have to go through one of the associations, and I'm sure there's more out there, but the two main big ones are the American Health Information Management Association, which is the association that I belong to, or the American Academy of Professional Coders. And each has their own nationally recognized coding credentials. So you're going to have to decide which one is for you, which association is for you. And, you know, if you're curious, then just let me know and I can do another video on that. But I have done a video about AHIMA and AAPC, and which one do I prefer. So naturally, I mean, I'm associated with the American Health Information Management Association. That is where I have my credentials through. So I'm more familiar with them. You can take the time to check out AAPC, or the American Academy of Professional Coders, if that's what you're interested in. So just be sure to do lots of research. And if you have questions, ask. You know, please feel free to ask, because I know it's a lot, and it's just like all this information all at one time. And I don't want anybody that's a student to get overwhelmed with, oh my gosh, there's all of this stuff I have to know. I'm telling you the stuff that's going to make it easier for you to understand what this is, okay? If you can get those three, medical terminology and anatomy and physiology, if you can get those down, you're already on the right path. Because when I started, I had zero experience with medical. I knew nothing about medical, but I'm a reader. So when one of the recruiters at one of the schools wrote these big long words, and he's like, well, what does that mean? And I'm like, that's a EGD, or that's a ear, nose, and throat doctor. He's like, how did you know that? He's like, nobody knows these. And I'm like, context. I mean, it's just broken down. You know, if you know if you know the little parts of the words, you put them all together, and boom, there you go. And so he's like, wow, you know. So I mean, it does take time to learn. I mean, like I said, it is a marathon. It's not a sprint. So you are going to be continuing to learn. It's a lot of reading. When you're in school, it's a lot of reading. And I do recommend highly that you do flashcards. And yes, while back when I was in school, they didn't have all these smartphones, and we had cell phones, but they weren't smartphones. And we didn't have all this electronic flashcards, and we actually had to legitimately do flashcards. I was the only one in my class who actually sat there and did flashcards. My mom did flashcards with me. She wrote some of the flashcards for me so that I didn't know the questions that was on the flashcard. So, I mean, I was the only one in my class who passed the test the first time, my certification exam. So that's something that you need to think about. You know, with these certification exams, you know, they're not easy, and they're built that way because, you know, you have to know what you're talking about. You have to know what you're doing. So just make sure that when you are taking the time to study, that you're doing some of the old-fashioned stuff, which is getting little index cards and doing flashcards, just plain old-fashioned flashcards. And sure, do it on your phone if you like, but I'm telling you, if you take the time to write it out yourself, it'll commit to memory better than if you were just kind of skipping on a phone and be like, oh yeah, sure. So that's some of my old-fashioned advice. Because like I said, I came up in a time where we didn't have these smartphones, and you know, we had to do things the old-fashioned way. So I highly recommend it. I think it was worth it for me. And I took the time to actually read the entire evaluation and management book. I read that book cover to cover, and I always talk about it too, that I did that because that was the only one that I had done. I had literally read that book cover to cover. because they were like, well, there's a lot of people that are not passing this part of the course, or they have to take it again. And I'm like, I am not going to go through that, because I was going through it at a pretty good clip, and I didn't want to slow down. All I wanted to do was just get out and start working, because, you know, I mean, coders make good money, and I wanted to get to work, you know. But I literally took the time to read that book cover to cover. And because of that, I've been able to understand evaluation and management a lot better. And it's easier for me, because, you know, I can just sit there and say, oh yeah, it's this, this, and this, and I can explain it. And there was people in my class that were like, why are you doing that? You don't have to do that. All you have to do is the lesson. Well, I understand that, but I mean, if I can take the time to learn all this other stuff too, it's going to benefit me. And it did. So, and I was able to pass the evaluation and management course fairly quickly when I was in medical coding school. So, you know, take the time, invest in yourself. And where do you find these materials? You can find them at the public library. Sometimes people don't want to go to the library, but I like going to the library. But there's a lot of books out there. And if you ask them, where can I find the medical coding section? I'm sure they'll be able to help you. Look for the most current coding books that they have. If they have 2018, that's fine. If they have 2019, that's even better. So just look for those. You can also go on eBay or Amazon and see what kind of medical coding books they have if you actually want to pay for a medical coding book. But I'm fairly certain that they have the testing manuals too for the credentials at the public library, because I have seen them. So just be sure to, you know, use all the resources that you can. Get flashcards. Go to a thrift store and get like an anatomy book. I mean, there's just cheap places if you don't want to spend a lot of money to learn different things about the medical field. You know, you don't have to know all this other stuff. Just hit those three first: anatomy, physiology, and medical terminology, and you'll be really good then. So, you know, that's my advice. But it is hard, but it's not unlearnable. So, I mean, you can learn it. You know, you just got to take the time to, and the drive. You got to have the drive to want to do it too, because it can get discouraging. So that's another thing too. Don't get discouraged, whatever you do. But if you are looking to get into the field, and the reason that you want to get into the field is because of the money, I want you to think about that before you do it. Because I have seen people that say, oh yeah, I want to make all this money, and then they get involved with it, and they start going to school and they don't like it, because they didn't know it was all this studying and reading. And you're going to constantly read, and you're going to constantly study, and you're going to constantly be tested. Because even when you go apply for jobs, they're still going to test you. They're going to test your proficiency and see how much of this medical coding do you know. So, I mean, even when I was first out applying for jobs, I had been to several places, and I had applied and had the door closed in my face several times. But they kept telling me, well, you know, you passed the test, but, you know, you just don't have any experience. And I'm like, well, you know, okay, like whatever, you know. But, I mean, they were always impressed that, you know, I was new just out of school and I still could pass the test. And I'm like, yeah. And then I go, well, sometimes we get people who can't pass the test. And so I'm like, well, I mean, you know, that's what you get certified for. This is why you have, you know, certification, because you know this stuff, you know, because some programs will offer a medical coding and billing certificate, but not the certification. So you still have to decide which association you want. Or which credential are you trying to work towards? So, you know, you got to look for those entry-level credentials and, you know, go from there. So I will be putting both association website information down in the description box, so that way you can check those out and see which one is a right fit for you. So, but I will say this. above all else, above all the studying and the sweating and the pulling your hair out, it is worth it. I have said this many times to many people. I don't know where I would be if I wasn't a medical coder. I have enjoyed, and I continue to enjoy, my work. I sometimes can't wait to get to work, and I know that sounds cheesy, but because I have such a passion and a drive for what I do, and that's what I figured this out. And I'm like, that's what this is. When people say that they're passionate about doing something, that's what this is. When I feel like I just can't wait to get to work, and I can't wait to do classes, and I can't wait to talk to my providers, and I can't wait to see how they've improved in their documentation, or what kind of challenge are they going to bring me now. Because I do get those providers that say, oh, I'm going to try to stump the coder, and they'll give me a question. I'm like, oh, okay, well, I can answer that, That's what this is. It's literally passion. And I love it. And I am going to continue to go further in this field, because there is a lot that I still need to do. I just haven't done it. I think I'm having too much fun right now as it is where I currently am. And so, but I will continue to do it. And, AHIMA has made so many things happen for me. I mean, just having this credential of mine, I'm a certified coding associate, and being affiliated, just having that designation after my name of CCA is a really good thing. They go, oh, you have an AHIMA credential. Yes, I do. Yes, I do. And I am one of a few, very few in my facility that has a AHIMA associated credential. So, I mean, I do stand out because of that, but I know many wonderful coders from the American Health Information not American Health, from AAPC, I mean to say, from the American Academy of Professional Coders. I know many good coders from there too. And so both associations are widely known and widely respected. So, I mean, either way you go, I mean, you're gonna find a home either way you go. And so for me, my home is with AHIMA, and I'm very proud to be a part of them. So, and I love talking about medical coding. I love, going to conference. See, because they changed it over from saying convention. Now they say conference. So I'm doing good. So that was a hard habit to break. So I love going there. I love talking with other leaders in the industry, and I love meeting other new coders and things. But if you're feeling kind of discouraged at all when you're in school, reach out and talk about what's going on. I mean, are you getting the kind of instruction that you need? Because I think sometimes with medical coding students, it is part of how they're getting taught too. So that has a lot to do with it too. It's the same thing like with providers with medical coders. Some have good experiences with medical coders because they're like me. And some of them, they kind of get like, oh no, I don't want that, because this person came after me with a red pen, and they were telling me I was wrong. And it just depends on how it's being approached. If you have an instructor that's just throwing a bunch of stuff at you and not making sure that you're capturing it, or you're grasping what is being taught, that has a lot to do with it too. But luckily now, right, there's a wonderful thing like YouTube that can connect folks that are new, and they're students, and they can talk about like, hey, I don't understand this. They explained it, but I don't really understand. Can you explain this? I've seen a lot. I've seen a lot, and I've coded many different disciplines. So if you got questions, if they're not inpatient questions, like a person that's inpatient in a hospital, then I can probably help you, because most of the things that I do are outpatient coding. And I do surgery coding as well. So, or I have done surgery coding as well. So, I mean, I can answer things pretty quickly there. But if you do have a question about an inpatient thing, I mean, I can help you try to look for an answer. But I'm always happy to help. I mean, honestly, I really love what I do. And like I said, I'm passionate about what I do. So, but hang in there if you are a student, or if you're about to be a student. Get prepared and get ready. And study, but give yourself breaks. Don't try to cram a bunch of things all at one time, because all you're going to do is burn yourself out and get yourself overwhelmed. Okay? So remember to take breaks. Snacks are always a good thing. Flashcards are always a good thing. Handwritten flashcards so that it can commit to memory better. So just some advice from a medical coder who was a medical coding student at one time. So I hope you all have a great evening and a great weekend, and I will see y'all again on Monday, because I have been trying to do these videos every day, and I've been pretty successful the last couple of weeks. So but yeah, every day about this time I upload another video, and and hope it helps somebody. So if you are a medical coding student curious about the medical coding field, if you're a veteran medical coder, or if you are a provider or a nurse, feel free to, I hope that you will like and subscribe to my channel. If you have any questions, let me know. I will put my email down in the description box, and I will see y'all next time. Thank you for watching. Bye.